The next presentation is by Idaira Rodríguez. She's a senior health economist, and she presented her PhD in economics at the Center for Health Economics at the University of New York. And the title of her presentation is Huntington Disease Burden of Illness, HDBOI, Study Methodology, Sample Representativeness, and Fieldwork Risk Mitigation Strategy during the COVID-19 pandemic. Thank you very much.
Hi everyone, my name is Idaira Rodríguez. I'm a senior health economist at HDBOI, and I'm the presenter and one of the co-authors of this poster. Huntington disease is associated with a large economic burden and a large impact in quality of life for patients and caregivers. The Huntington Disease Burden of Illness study aims to provide an up-to-date assessment of the burden of Huntington disease by disease stage and from a multinational perspective. The countries that were included in this study were USA, Germany, Spain, Italy, France, and the UK. The methodology of this study is explained in detail in this poster and also represented in figure 1 in the left-hand side of this poster. Basically, data was collected from physicians by means of the case report form that collected demographic, clinical, direct, and indirect costs associated with Huntington disease. Then, physicians invited patients and caregiver to complete the patient and caregiver questionnaire, which were optional. In the patient and caregiver questionnaire, information on demographic, health status, non-medical, and indirect costs was collected. All the information captured by these three questionnaires was used to establish the clinical, economic, and humanistic burden associated with Huntington disease. This study was planned and designed before the start of the COVID-19 pandemic. However, the fieldwork process started just after its start. In specific, data was collected between August 2020 and May 2021, with patients and caregivers reporting their health-related quality of life and other characteristics at the time of completing the questionnaire. However, we asked physicians to report patient health resource use for the 12-month period between March 2019 and March 2020. This is just before the start of the pandemic, in order to minimize the risk of underestimating the economic burden associated with Huntington disease. This is because in the period, the fieldwork period, there was a limited access to health care linked to the restrictions that were put in place by the participating countries. Other strategies were taken to mitigate the effect of COVID-19 on the fieldwork process, and they are listed here in the poster. And we also included questions for patients and caregivers to monitor the effect of the pandemic in health resource use, physical and mental health. If we move to the results section, we see that the final sample consisted of 2,094 patients with Huntington disease, of which around 40% were early stage, 33 were mid stage, and 26.1 were advanced stage. Disease stage was assessed by the treating physician. In table 1, we can see the breakdown of results. So this is the total number of CRF, case reports form, so physician questionnaires, patient questionnaires, and caregiver questionnaire. Representation across countries was similar. It's important to note that the total number of patient questionnaires was 23% of the total, and the total number of caregiver questionnaires was 24% of the total. As I mentioned before, they were returned on a voluntary basis and they were optional. However, the representation across these stages is similar to the overall sample. In table 2, we see the results of the COVID questions, and we see that approximately 75% of patients reported that the COVID-19 had an impact on their mental health, 72% an impact on the health resource use, and 64% an impact on their physical health. The impact is especially important in the early stage patients. To conclude, it's important to note that the Huntington disease burden of illness study has information on over 2,000 patients and provides novel data to quantify the Huntington disease health resource use by disease stage and increases the evidence base for the Huntington disease community. Well, many thank you for your attention. Please do not hesitate to contact me if you have any further questions. My email is idaira.rodriguez@HDBOI.com. Thank you.
Thanks, Idaira. We don't have any questions yet from the audience, so if anybody has some, please write them in. Now we have a few more minutes for questions. I guess I'll start with where are the next steps in applying this in terms of for other associations, particularly the charities and that are trying to kind of get support and really push home their messages for supporting people with Huntington's disease.
Yeah, thank you so much for listening. I'm very happy to be able to discuss our work here with you today. So yeah, actually, there are plans for disseminating the results of this study. This poster is just an introduction to the methodology we have implemented and to share with you the different methodology and COVID mitigation strategy in case it might be helpful for some other researchers. And we do plan to publish a manuscript with the results of the economic burden and the humanistic burden. And in this conference, actually, we have another poster where we see some results from the study for the European patients from our study. Is look at the demographics and health resource use for the European patients. So I invite you to visit that poster where you will find more information on those patients.
Yeah, I think we have one question come in. How do the changes in mental health in HD patients compare with those changes in the wider population? And that is from Leslie Jones.
Thank you, Leslie. I guess this refers to the COVID questions where we asked the impact of COVID in the Huntington disease patients. Actually, we did implement these questions in the both patient and caregiver questionnaire. So we can compare, actually, we do have that information and we can compare the results from the patients and then caregivers. And it's true that also for caregivers, as it says here in the poster, we have a similar impact on health resource use and on mental health. And in physical health, the percentage of the impact of COVID is slightly smaller, but it's still important. So yeah, we can compare with them.
We have another question from Davina Hensman. she wasn't sure who joins, if it's the patients or the clinicians, and if it is the clinicians that are feeding in the information, is there a risk that busy doctors don't fill in them is causing bias?
So the doctors are invited, they are screened and invited to participate in the study, and they then, according to the screening criteria, invite patients to participate. Of course, there is a risk of some selection bias or participation bias in terms of patients and doctors, but we do collect a large number of patient characteristics that would allow to control for them to compare with other population that has been not enrolled in the study. Sorry.
Yeah, so I just have to push on to the next speaker, but we have more questions in the chat. So if you're happy to answer them offline, Idaira, that would be really appreciated, I'm sure, by the audience.